So for today, we have 29 new test positive cases here in British Columbia, bringing our total to 1,647 people who have tested positive for the virus here in BC. That includes 686 people in the Vancouver Coastal Health Region, 680 in the Fraser Health Region, 97 people on Vancouver Island Health, 150 in the Interior Health Region, and 34 in the Northern Health Region. We have ongoing 20 long-term care or assisted living facility outbreaks and one outbreak in acute care area. There are no new long-term care facility or assisted living outbreaks. However, we do have some new cases in that area, bringing our total up to 288 people who have been affected in the long-term care or assisted living area. In addition, we have ongoing outbreaks, as you're aware, at correctional facilities, including the Mission Federal Correctional Facility, where we are now up to 70 people who have been affected by COVID-19, including 60 inmates. There are no new cases, and active support and outbreak investigation continues at the Okanagan Corrections Facility and the agricultural area in the Interior Health. Of our cases, 115 are hospitalized, and of those, 54 are in critical care ICU. Unfortunately, in the past day, we've had 3 more people who have died from COVID-19, all of them in long-term care, bringing our total up to 81. And as we reflect on the tragedy that has been our outbreaks in long-term care, we again send our condolences, and our heart goes out to those people who, their families, the caregivers, and the communities from these people. We have 987 people who are now considered fully recovered from COVID-19. As you know, yesterday we presented our latest modeling information and the latest numbers and some of the epidemiologic information so that everybody is aware of where we are in BC and how we're progressing through this pandemic, our pandemic here in British Columbia. This information, including all of the slides that we presented yesterday in the details, are available on the BC CDC website. In addition, the BC CDC has a new interactive dashboard that allows you to get ongoing real-time information that's posted online, and you can look at that and interrogate that by different areas and different aspects of the pandemic, and I hope people will go to that and have a good look, and it will help answer a lot of the questions that we aren't able to give you in details during our media briefings. There's also a new search bot, which is something new to me, but I understand now that it can help us get the latest information. It's on the BC CDC website, so you can type in your questions and get direct access to the information that you need on that website. This is all, of course, part of our commitment to the people of British Columbia to be transparent and to share as much information as we can so you know exactly how we are doing together as we're moving through this pandemic. The modeling, as we talked about yesterday, shows us how we have done in the past few weeks, particularly since we put in place some of these incredibly restrictive measures here in our communities across the province. And it also gives us an idea of where we are now in terms of our pandemic and where we may be going in the coming weeks. And it also gave us some ideas of when and where we may be looking at lifting the restrictions and orders that we have in place now. And we've been trying to think of, how do we describe where we are right now? We really are in a hurricane, in a major storm. But we have made considerable progress in our province, and it is because of what everybody has done together. We have listened to the orders and the restrictions that we've put in place. People have shown their compassion to each other, their kindness, and their commitment to protecting our loved ones, protecting our seniors and elders as best that we can, and protecting our healthcare workers and our health system so that it's available for all of us when we need it. We're also protecting our own families and our own communities by doing the things that we have asked you to do. And again, you know, the very basic things that we've been talking about from the very beginning continue to be the most important. Washing our hands frequently, not touching our face and eyes, covering our cough, staying away from others, particularly if you have any symptoms at all, staying home, staying away from others, and importantly right now, continuing to keep a safe distance from people so that we can continue to not only bend this curve, but make sure that we're not transmitting this virus, that we can stop those chains of transmission, and we can bring our numbers down to zero. We can't lose sight of the fact that we continue to have people who are affected by this. We continue to have outbreaks, we continue to have transmission. And so we are not at the point yet where we can let up our guard. The storm is still raging, and you know, tragically we see that in the fact that people are still dying from this virus here in BC. The risk of a spike or another outbreak or more clusters in our community is something that's a very real concern for me, and we know it continues to happen. We know as well that we are subject to what's going on around us, and that has become really apparent. This is a global phenomenon, and we know that this is still a major problem in communities all around us. And there's been, you know, Alberta, for example, has done many great things, very similar to what we've done in BC, but we're still seeing clusters there. And what happens here affects what's happening in Alberta and vice versa. We also know that there's ongoing challenges in other provinces of Canada, in Quebec and Ontario in particular, and what happens there affects us. So we need to make sure that we continue to take the measures that we need to do here in BC to protect our families and our communities. The easing of restrictions, when they come, will be gradual and will be slow and thoughtful. We took very quick action to get us into this, but we don't want all of the sacrifices that we have been doing across the province to be for naught. We need to make sure that when we open things up, we do it in a measured, thoughtful way that protects us and protects all of us while opening up our economy, while opening up our health system as we move forward. And we've talked a lot in the last few months about the fact that there's a long incubation period for this virus. People can be exposed and not be sick themselves for up to 14 days. So we have to think in 2-week increments. So what happened on the Easter weekend, for example, we're going to start seeing if there's impacts on our communities in the coming days. When we start to lift restrictions, we're going to be doing it gradually and thoughtfully, and we're going to be watching. And that watching period will be in 2-week periods, so that we make sure that we're not getting ahead of us and we don't start seeing rapid, explosive growth that we've seen in other places around the world and in Canada. So this thoughtful and careful approach will be taken, and if we continue to see sustained improvement in the next 2 weeks, and this is really critical, we look at the modeling and we show that we are still right in the, we're nearing maybe the end of our storm, but we're in that eye of the storm right now. We're not going to be taking any measures in the next 2 weeks, but we are planning. We are planning for what is going to look like when we get to that point in May, probably in the middle of May, where we are able to take those actions that help increase our social connections, increase our industrial and our business connections, and also increase opening up of our healthcare system. So the new normal will, however, be a modification of some of the things that we continue to need to do today. So things like cleaning our hands, covering our cough, staying home when we are ill, no matter how mild it may be, those things are going to continue. Our distancing and our safe distances between us are going to continue, and we need to look at how we can open our schools, open our businesses, but still maintain those safe distances between us. And that is what we'll be working on with you and for you in the next couple of weeks. What we need to do now is to hold our line, and please keep doing what you've been doing. Continue to show the kindness and care that we know is important for all of us to get through this together, and that you have been showing across BC, and do all you can to flatten our curve to zero. You are making a difference, and we are making a difference together. So we need to continue to be kind, to be calm, and to be safe.